If you are over 65 and your doctor recently told you that your blood sugar is just fine, I need you to stop, take a breath, and listen very carefully. Because here is what I have learned in more than 2 decades of caring for older adults. A single fasting glucose reading has missed far more hidden diabetes than it has ever caught. And the seniors sitting in front of me in the exam room, the ones who came in expecting to hear everything looks great, often have a number quietly climbing inside them that no one ever bothered to measure. I'm Dr. Thomas Reynolds. I practice internal and geriatric medicine, and most of my days are spent sitting across from people your age, people in their 60s, 70s, 80s, and beyond, people who want nothing more than to keep their independence, their clarity, their balance, their memory, and their dignity. And one of the things I have come to understand, slowly and sometimes painfully, is this. There is one blood test, just one, that catches what the others routinely miss, and most older adults never even know to ask for it. In the next several minutes, I am going to walk you through that test. I will explain what it actually measures, why your fasting sugar can look perfectly normal while damage is quietly happening, what the numbers really mean, what can make the test misleading, and most importantly, exactly what you should do once you have your answer. By the end of this video, you will know whether this test has ever been done for you, what your result should look like, and how to bring it up calmly with your own doctor. And if you are watching this right now at 65, at 72, at 79, at 84, drop your age in the comments below. Not because I need it for any algorithm, but because every time you tell me, I get a clearer picture of who I am speaking to. And thank you, honestly, for being here with me. Let us begin. Number 1. The test itself. It is called the Hemoglobin A1c, sometimes written as HbA1c, sometimes just called the A1c, and before you tune out because the name sounds clinical, let me explain what it actually does, because the way it works is almost elegant. Hemoglobin is the part of your red blood cell that carries oxygen. Sugar glucose in your bloodstream likes to stick to that hemoglobin. The more sugar floating around in your blood, day after day, week after week, the more of it glues itself onto your red blood cells. And here is the key. Your red blood cells live, on average, about 3 months. So a single A1c test gives your doctor a 3-month photograph of how high your blood sugar has been running. It does not care what you ate last night. It does not care if you were nervous at the appointment. It does not care if you fasted. It is, in the most honest sense, a memory test for your blood. That alone is reason enough to ask for it. But the deeper reason, and this is what most people miss, is what this test reveals, that a fasting glucose reading simply cannot. Number 2, the hidden truth about the fasting test. For decades, the standard screening test in your annual physical has been a fasting blood glucose. You show up in the morning, you skip breakfast, you give blood, and they hand you a number. And if that number falls below 100, most doctors and most patients breathe a sigh of relief and move on to the next item on the list. That sigh of relief, after the age of 65, can be a quiet act of self-deception. Because what I have seen again and again in my own practice is this. An older adult with a seemingly perfect fasting glucose can sit down for a normal meal, toast with jam, a bowl of rice, a sandwich, and a piece of fruit, and within an hour or two, their blood sugar can climb into ranges that would frankly alarm me if I saw it on a glucose monitor. And then, a few hours later, it sinks back down. By the time they come in for their next fasting test the following year, everything looks fine again. Think of your bloodstream like a river. A fasting test is a single cup of water drawn from the river at one quiet moment early in the morning before the day begins. A1c is the average flow of the river over the entire season. It sees the floods you had after meals. It sees the slow rises after snacks. It sees what the cup never revealed. This is why the A1c is often called the test that finds hidden diabetes. The disease is not really hiding, it is just that no one was looking in the right place. Number 3, what the numbers actually mean. Here is where it becomes really practical. When your doctor orders an A1c, the report comes back as a percentage. Most labs print the result clearly on the page, and the categories are fairly consistent across the world. A1c below 5.7% is generally considered normal. A1c between 5.7 and 6.4% is the range that most guidelines call prediabetes, sometimes called impaired glucose regulation, which is a long way of saying your blood sugar is higher than it should be, but not yet high enough to be called full diabetes. And an A1c of 6.5% or higher, confirmed on a second occasion, is generally diagnostic of type 2 diabetes. Now, those numbers matter, but here is something I want you to understand that almost no one says out loud in the exam room. Prediabetes is not a small problem. In older adults, the slope from 5.9 to 6.3 is not a gentle hill. It is often the start of a slide that, if ignored, will quietly reshape the rest of your life. Blood sugar that stays mildly elevated even in that 5.9 to 6.3 range has been linked in research trends to a higher likelihood of nerve damage, of memory concerns, of kidney stress, of slow wound healing, of balance problems, and of cardiovascular strain. None of these may show up overnight. None of them may announce themselves with a sharp pain. They arrive like weather gradually, then suddenly. Knowing your A1c is not about labeling yourself. It is about catching the weather before the storm. Number 4, the danger that hides in just a little high. When I sit across from a 72-year-old patient and tell them their A1c is 6.1, I can usually predict what happens next. They smile. They say, "Well, at least it is not diabetes." And I nod because I understand why they say it. But then I lean forward because this is the moment the conversation actually matters. The truth is, the older we get, the less forgiving our bodies become of even mild blood sugar elevation. The lining of our blood vessels, that delicate inner wall, becomes more sensitive. The nerves in our feet become more vulnerable. The tiny filtering units in our kidneys work harder for the same job, the part of the brain responsible for memory and processing becomes less resilient. And the immune system, which already loses a little sharpness in older age, becomes less effective at handling small infections. So when I say that prediabetes in a 70-year-old is not the same as prediabetes in a 35-year-old, I mean it literally. The same number can carry very different weight depending on the body sitting behind it. And after 65, the body is asking for a tighter margin, not a looser one. A fasting test says, "You looked fine." At the moment, A1c says, "Let me tell you what your blood has been doing." Number 5, the symptoms you might be quietly ignoring. One of the most uncomfortable parts of this conversation is the realization that the symptoms of rising blood sugar in seniors are often frankly ordinary. They are the kinds of things we dismiss as just getting older. A little more tired in the afternoon, a little more frequent urination at night, a bit of blurred vision that comes and goes, a small cut on the foot that takes longer than it used to heal, some tingling in the toes, a sense of being thirstier than you remember. I cannot tell you how many times I have heard an older adult describe one of these symptoms to me and then say, almost apologetically, "I figured it was just age." Sometimes it is just age, but sometimes sitting quietly behind that just age is a blood sugar number that has been climbing for months. This is why the test matters. More than the symptoms, because by the time the symptoms are loud enough to notice, the underlying process has often been working for a long time. The A1c gives you a chance to hear the problem before it shouts. Number 6, what can make the A1c reading misleading? Now, and this is the part of the conversation I think is most important, because honest medicine respects the limits of its tools. The A1c is not perfect, and for some seniors, it can be quietly wrong. If you have certain forms of anemia, especially iron deficiency anemia or anemia from chronic disease, the A1c can read higher than your true blood sugar would suggest. If you have had recent blood loss, or if you have received a blood transfusion, your red blood cell population is in flux, and so is the A1c if you have advanced kidney disease. The test can also drift in either direction. Vitamin B12 deficiency can push it up, and certain genetic and ethnic variations affect how quickly red blood cells turn over, which also shifts the number. Now, does this mean you should skip the test? Absolutely not. It means you should get the test and then have a calm, honest conversation with your doctor about any of these conditions that apply to you. A good physician, knowing your full picture, will interpret the A1C correctly and may add a fasting glucose or a different test called an oral glucose tolerance test, which measures how your body handles a sugary drink over 2 hours. Each test sees a slightly different angle of the same story, but the A1C remains, in most situations, the single best starting point, and that is why I am telling you about it first. Number 7. What to do with your answer. So let us say you have had the test, or you are about to ask for it. What then? If your A1C comes back below 5.7, that is genuinely good news. But please do not let it be the end of the conversation, especially if you have a family history of diabetes, if you carry extra weight around your middle, if you are on medications that can raise blood sugar, some steroids, certain blood pressure pills, some psychiatric medications, or if you have been told you had gestational diabetes years ago, please discuss repeat testing with your physician every 1, 2, 3 years. If your A1C lands between 5.7 and 6.4, this is your invitation to act, not with panic, but with intention. Walking 20 to 30 minutes most days has been shown in research trends to improve how your muscles absorb sugar from your blood. Building meals around vegetables, lean protein, beans, and whole grains, and reducing sugary drinks, refined carbohydrates, and very large portions of starch at any one sitting has been linked to better glucose regulation. Strength training, even gentle resistance work a couple of times a week, has been associated with improved insulin sensitivity, and losing even a modest 5 to 7% of body weight in studies on older adults has been linked to meaningful reductions in the risk of progressing to full diabetes. None of this is about perfection. It is about consistency. The body responds to what you do most days, not to what you do once and forget. If your A1C is 6.5 or higher, your doctor will likely discuss a formal diagnostic plan, possibly including repeat testing, medication, and a structured lifestyle program. The key message here, please hear me, is that being diagnosed is not a sentence, it is a starting point. Many older adults with consistent daily habits and appropriate medical support have been able to bring their numbers down meaningfully and keep their independence, their mobility, and their clarity intact for years. In every case, please work with your physician. Hidden diabetes is not something to manage alone, but it is something that responds remarkably well to informed, consistent, gentle action. Now, if this video has given you any clarity at all, I would be grateful if you would subscribe to this channel. Not because I am asking for numbers, but because each week there is more I want to share with you about circulation, about kidney health, about memory, about balance, about strength, about the small daily choices that quietly protect the life you have built. Hit the subscribe button and the bell, and let me keep showing up in your feed. It costs you nothing, and it helps me keep doing this work. A final word. A single blood test, one small tube of blood, one 3-month photograph of your body's sugar story has the power to reveal something that could quietly shape the rest of your life. And all it asks of you is a single question. Ask your doctor, ask whether your A1C has been checked in the last year. If not, ask why not. If the answer is, we will get to it next time, gently ask, can we please get to it this time? That is not being a difficult patient. That is being an informed one. That is someone who has decided that independence, mobility, clarity, and dignity are worth one extra sentence in the exam room. I have sat with thousands of older adults across my career. The ones who thrive the longest are not the ones with perfect genes or perfect labs. They are the ones who pay attention early, who ask the second question, who choose the next small honest step when the big picture feels overwhelming. You are not too old to begin. You are not too late. The body at 65, at 75, at 85 still listens to what you do today. Thank you for spending this time with me. If this helped, leave a comment below telling me what you will do next. Ask for the test, schedule the appointment, share this with someone you love. And if you have not yet, subscribe and join us here each week. I will see you in the next video.